Okay, hello everyone. I'm glad to be here again to deliver a brief presentation about my recent systematic review paper that published in Journal of Global Psychiatric Archives about the mental and psychiatric disorders among Yazidi children and adolescents. So as name applies, this systematic review reveals high rates of mental and psychiatric disorders among Yazidi young people mainly after the invasion of Daesh or so-called Islamic State of Iraq and Syria, ISIS, in 2014. So first of all, I would like to introduce you who is Yazidi. Maybe the majority of you are watching this video do not know who is Yazidi. So the Yazidi people are the minority group of Kurdish that mainly living in Iraq between the two main governorates of Nainawa and Hok, notably in Sinjar district and Shekhan. The Yazidi term comes from the Kurdish language Yazidi or Ezda, which means I was given, in another word, I'm created by God. So the Yazidi people are practicing the Yazidism, which is a minority religion they are following from the centuries. So as we mentioned, after the invasion of Daesh in 2014, this minority have been targeted by ISIS, and they have experienced the violence, genocide, enslavement, and forced migration and displacement. And according to Yazidi, the invasion and the persecution of 2014 considered the 24 ferments, and the ferments is a Kurdish term which means a genocide campaign. So we aimed at this study to examine the mental and psychological health problems among Yazidi children following the forced migration, enslavement, genocide, and violence. So we followed the PRISMA protocol for systematic review and mental health study, and we searched for eligible papers in PubMed and Google Scholars. And our search yielded 182 publications, but after the screening of the abstract and full texts, we extracted 5 papers, which is considered to be eligible for this systematic review. So our findings indicated that the Yazidi children, the Yazidi in general, Yazidi children and adults have been significantly impacted psychologically in 2014 because the Daesh or ISIS have been brutally killed the people, killed the male and the man, and used the girls and the women as a sex slave. They sold between them and they use it for their sexual purpose. So I'd like to go directly to this is the flow chart of the PRISMA, how we searched the papers and how we removed and eliminated papers and how we assessed the papers for eligibility, and finally we included 5 papers. So here the table 1, the extraction of the included papers that were eligible for these papers. So I would like to talk about this, which is give you a holistic idea what's going on and what had been happened to Yazidi people. So as you can see here in the first row and column, we have a list of authors, and then we have a country, the study of the country of the study, and the samples, age measure, and the result and limitation of the studies. So all of the study are not have very old history. They have been conducted in 2018, 2016, and 2018, 2016. Yeah. So 2 of them have been conducted in the Kurdistan region of Iraq, and the last 3 papers have been conducted in the Turkey. So so as you can see in the results, you can see there's a very scary data and statistics about the mental health and psychiatric problems among Yazidi people. So these two authors conducted the study aimed to examine the psychological problems among Yazidi and children, revealed that PTSD, depression, and anxiety are prevalent among them, which is very common among them. 65.3% of Yazidi children have scored above the cut-off line of this heart disease, means their symptoms of depression and anxiety, which is beyond the normal. They become a disease, become a disturbance for them. So another study conducted in Kurdistan in 2018 and aimed to indicate the prevalence of PTSD and depression and associated risk factors such as self-esteem, and which is have been conducted among the former ISIS child soldiers, Yazidi ISIS child soldiers. The Yazidi people, they use brainwashing for the young people, for the children, and they converted their religion to be Islam, and they have used them as a frontline soldiers, and as you can see, there's very scary data, that the depression among these are Yazidi boy children, almost almost 45%, and the PTSD among them is 28% of these are Yazidi boy children have PTSD and anxiety, almost the same result of depression. 45.8% they have anxiety, and they have somatic disturbances as well, which is 50%. So yeah, the major all of the study have emphasized that the psychological and mental health problems among Yazidi children is very high. Another study have been done in Turkey when the Yazidi children have been migrated or displaced to the Turkey. So then the aim of the study also want to indicate the frequency of mental pathology among them. The depression also indicate that the 32% of Yazidi children have depression, and 36.4 percentage have PTSD and anxiety and other psychological disorders. Another study, the last two studies have been conducted in Turkey, and also they aim to indicate the mental health problems among Yazidi people. Almost they gave us the same result as PTSD is 43%, depression is 27, and behavioral problems is 9, anxiety disorders also here almost the same result. And the depression among Yazidi children is 36%, PTSD is 10%, and conversion disorders or behavioral disorders is 28%, and also the study indicated the other new disease among them, which is the adjustment disorder. 29% among them have adjustment disorders. So as you can see in this table, there's a data, there's a statistics we have to be considered on, because these are children are living in very challenging mental health situation. So here the result of the study and then the discussion and the diagnostic measurement that used for the included study, and we clearly discussed all the results of the mental health problems of Yazidi children. So here we have a recommendation which is very important. The authorities and the health authorities in Iraq and in Kurdistan or in another country, which is the Yazidi people located in, to follow this recommendation, because we in this study we indicated very scary data about Yazidi people, and we are recommending to the NGOs and the health authority to continuing supporting the Yazidi children and providing them the mental health and psychosocial support, especially during this period, because this in the development, they are in the developmental age, and they need social, emotional, and cognitive and physical development, and they need reintegration to the normal society, and they need safety and security. So supportive intervention should be included a comprehensive mental and psychosocial rehabilitation, which is focusing on the psychotherapy and focusing on the group psychosocial support for boosting and enhancing their resilience and well-being. So this is all about this paper, the systematic review. I hope you now have a clear idea about this paper and about the mental health problems of Yazidi children, which is significantly been impacted by ISIS invasion 2014, and they are really in need of mental health and psychosocial support. So I hope now you have an idea about Yazidi children's mental health. So I hope you enjoy this video, and bye bye.